All right, Michael, you are good to get started. You need to unmute yourself.
Good afternoon, everybody, and thank you very much for joining us. We're very pleased to host this discussion on the importance of investments in health to sustained economic recovery after the pandemic. We're especially grateful to members of our corporate program for making exchanges like this possible. I want to recognize and thank the director of the Dialogues corporate program, Eric Brand, for organizing this event and for his superb efforts to engage the corporate sector in the Dialogues work. As you know, Eric publishes our daily Latin American Advisor, and I hope many of you read that for very valuable information and analysis. I also want to thank my colleague, Kate Blancett, for her help with today's event. As all of us know, the pandemic has exposed the vulnerability of those with poor health in Latin America and the Caribbean. The mortality rates in the region are tragically high, among the worst in the world. The region has only 8% of the world's population, yet has registered roughly 35% of COVID deaths. In addition, chronic health problems are also damaging the region's growth prospects. Even in a normal year, prior to COVID, poor health reduces global GDP by 15%, according to a recent report from the McKinsey Global Institute. As the health and economic consequences of the pandemic become better understood, policymakers will be compelled to look hard at ways that health is linked to economic activity, equality, and well-being, and also how scarce fiscal resources can be most effectively employed to improve and strengthen the health sector. This afternoon, we will examine precisely that question, how governments and stakeholders in the region can build momentum in order to make necessary changes to the whole health ecosystem and target investments in health that will have the greatest economic post-pandemic impact. It's a critical question for the region's long-term well-being, and fortunately today we are joined by three distinguished speakers who have agreed to share their expertise and insights. First, Luis Miguel Castilla, very good friend, former Minister of the Economy of Peru, and is also a member of the Inter-American Dialogue. Jana Remes is an economist with the McKinsey Global Institute, who's been an important addition in recent years to our board of advisors of our daily Latin America Advisor publication. And Jana, we welcome you again. And Rolf Hunninger of Roche Pharma, who is joining us for the second time as an event speaker at the Dialogue today. And Rolf, it's wonderful to have you back with us again. So, pardon the very brief introduction of each of our speakers. I invite all of you to consult their very impressive bios on our website. Each of the speakers will open up with roughly 6 to 8 minutes of remarks, and that will leave us ample time for question and answers and what I'm sure will be a very productive and interesting exchange. And so with that, I want to thank everybody again very much. We'll be using, by the way, our Q&A function like we do in our usual webinars. And so if anybody has a question, please feel free to pose it. And also, you could also send questions via email to meetings@thedialogue.org if that's preferable for you. So with that introduction, it's a pleasure to turn it over to Jana now to get us started. Jana?
Thank you, Michael. And thank you, Eric, for inviting me again to join the conversation. So until the pandemic, health really was not part of the economic growth conversation, as economists have really been focused on the costs of healthcare, and oftentimes it can be afford the healthcare, but particularly as populations age. And as Michael already referred to, our research shows that this is a big mistake. Even before the pandemic, poor health created a loss of 15% of our GDP across the world and across the Americas as well. And this is estimated to be roughly twice the economic cost of pandemic last year. So it's a very substantial cost. And the reason is because people are dying too young, or they suffer from conditions that don't allow them to live a full social and economic life. These costs reflect the fact that even though we tend to think of health as a challenge of largely aging, actually 2/3 of Latin American health burden occurs on people in the working age. This is because people are suffering from diabetes or heart conditions, lower back pain, or sight impairment. All of these things, they can lead to the fact that you either exit the labor force too early, you are more on sick leaves, or you are unproductive while you are at work. We call it presenteeism. So you are present at work, but not as productive because you worry about your own health condition or other folks near you. And some folks will exit the labor force because they are caring for others who need that because of their health condition. So the cost is high, but on the flip side, the good news is that if we make health a priority and really focus on improving health and thinking about it as an investment rather than a cost, there is a very substantial upside. We estimate that over the next 20 years, we could reduce Latin American disease burden by roughly 1/3. And this would come largely from prevention, shifting focus into maintaining health rather than just treating disease, through changes in lifestyle and behavior that particularly increase the risks of some of the long-term chronic diseases, as well as some of the preventive medication, everything from preventive heart medication, for example, or making sure that people take their medicine consistently rather than lapsing. So that would be roughly 2/3 of the opportunity. The last third then comes from therapeutic interventions, everything from cataract surgeries and other surgeries to physical and psychological therapies. If we did that shift to a really focusing on health as an investment, the upside would be very large, both individually in terms of quality of life as well as economically. We estimate that you could add 10 healthy years to everyone's life on average on the region. So that would basically mean that 65 would be the new 55. Who wouldn't want that? And the economic benefit would be substantial. We could add 8% to the region's GDP by 2040, which would add roughly 0.4% of growth every year over the next 20 years. That definitely is good news and something we definitely would want as we are coming out, hopefully, of the COVID in the coming months. Of course, as an economist, the first question is how much would that cost? And it wouldn't need to cost very much. We estimate that every dollar invested on the health priorities would bring in $2 of GDP roughly across the region. And that, even if you have some improvements in the efficiency, we could even reduce that the relative cost of these interventions. We estimate that roughly 60% of the opportunity could be captured with less than $1,000 invested for each additional healthy year added. So even though we tend to think of it as an expensive operation, I think the economic costs may not be at all as large as people often fear. Of course, if we are able to address the third of the health burden that we know how to do with known interventions, what we already know what to do, that still leaves 2/3 of the region's health challenges that we expect without a solution. And that means that innovation continues to be a big part of what we do. And I think we need innovation in terms of new treatments, better understanding of diseases we currently don't know very well how to treat. Things like neurological conditions as well as mental health conditions are big areas where we actually don't know and don't have effective treatments. Some of the other treatments that we have are not necessarily as effective in real life as they are in clinical trials. So basically making it easier for people to maintain their health routines. And last, and perhaps most importantly, we really do need to invest more on how do we help people make healthy choices. Given the fact that we have tended to invest the regulatory requirements for new treatments are very clear, and we have a lot of evidence of their impact. There is much less so on changing behaviors, improving the practices that maintain healthy life for people for the long term. We just don't know as much about that. So prioritizing that and shifting into the preventive side continues to be an important part. So overall, it's very clear that COVID has brought health at the top of everyone's agenda. And we truly hope that we are taking advantage of this moment and keeping it there for everyone, not just the healthcare providers, but the companies, the governments, the social sector, so that we can really start rethinking health, not just as a cost to manage, but an investment, so that we can improve quality of life as well as economic prosperity for the region and for the globe in the coming decades. Thank you.
Great. Thank you, Jenna, for those remarks. And I'd certainly welcome having the 55 being the new 65. That would be good. Let me turn to Ralph now for some opening remarks. Ralph.
Okay, so thanks very much, Michael, and thanks very much to the Dialogue for the opportunity to participate in this important panel and in the discussion. When I look at health systems in Latin America, obviously they are marked by a lot of deficiencies. And I think you see that in infrastructure, and you see it through the entire patient journey. And that starts, as I said, from prevention and diagnosis and goes to treatment and continued care. And now these deficiencies, they are for a long time already a result of the low investment and as well the low efficiencies that exist. And the consequence we can easily see now in the overcrowded health institutions and the lack of trained physicians that we have and face in many places in Latin America during this pandemic. Now, this has again as well a huge impact on the economy, as it forced basically the governments to take desperate restrictive measures from the very beginning in order to try to control the pandemic. Now, from a health point of view, well, we are witnessing actually a triple catastrophe. Well, the first one is directly related to the COVID-19, which is, I think, that you see in the overburdened health system and the deaths that occur. But the second one is the increase in poverty and its impact on malnutrition in health in many ways. What is very often overlooked is the third one, which is in regard to the non-communicable diseases. And that for the last years, many did not get any diagnosis or get any treatment because the people were afraid of going to the medical institution, or as well, there was no place in the medical institution to get care. Well, we have seen in our statistics drops of 30 to 50% of diagnosis in diseases like cancer or multiple sclerosis, and very significant drops as well in the control of cardiovascular disease and diabetes. Well, that actually is very significant because a patient that loses his opportunity to be early detected and treated early, which actually often means that instead of a curative treatment, these patients will get palliative treatment. And let's give an example. So if you look at breast cancer, if you are in an early stage, depending on the type of cancer you have, but in a 5-year survival rate is about 99%. But in advanced stages, it can go as low as 28%. And you can see a year of waiting in a cancer that actually can be much too much. Now, it's not only less effective, but as well an advanced patient is tremendously more expensive. So if you look at this, then I think it means that the governments, they will need to balance for these competing demands in non-communicable diseases and infectious diseases. And that means health systems will need to use their resources efficiently and as well invest in innovations that support their sustainability. Well, in many disease areas, medical innovation actually is paving the way for a more personalized approach to healthcare. So it's not like treating everybody for the same way. But I think this allows for a better understanding of diseases, a better diagnosis, and especially as well, much better treatment outcomes. And in this respect, I really think that personalized medicine has the potential to support the sustainability of health systems, and as well a better cost effectiveness, and at the end produce a healthier and more productive society. Now, where we as Roche, how we see we can contribute to improving health. And I think there are two things that we can do. The natural one is the scientific groundwork that we do in order to foster personalized healthcare. But I think the other one is equally important, and it is the collaboration in the transformation of health systems. Let me explain that a bit. So for more than 20 years, actually, we work on, and I think as a pharmaceutical industry, and we are in the forefront, I think we work on helping to lay this groundwork for the personalized healthcare. So it's diagnosis and treatment, and get this get much better and not giving everybody the same and just hoping for a good result. So I think we say it's the right treatment for the right patient at the right time. No? Now, there is a lot of collaboration ongoing with governments and insurers and other stakeholders, so we can promote this more efficient data collection, and with that, better direct the resources and in the allocation, and with that, at the end, get much better outcomes. And our focus is actually to develop medical solutions for exactly the therapies that Jana was mentioning. So there's a lot of focus on the improving of quality of care and quality of life and prolonging of life for people in neurosciences and in multiple sclerosis, Alzheimer, autism, and so on, and to give them a longer and more fulfilling life and a more productive life for the economy. Now, as I said, the second way of how we can do something for the improving of the health system is shape it. And we recognize that just making innovation in science and diagnostics actually doesn't make any sense when at the end the people don't have access to it. So our responsibility is to find ways to improve health for all. And I think that's what really drives us to collaborate with public and private sectors and then co-create solutions that allow us to improve patient access and to have a faster and better care. Well, one of the examples that I would like to mention is the public-private collaboration is Movement Health 2030. So as Roche, we are actually co-founders, and I have the pleasure to serve as a member of the advisory board. And what is it? So the initiative is actually, I would call it a collaborative platform that brings together multi-sectoral experts and corporations and future health leaders. And the objective is to identify and address the health challenges of the future and with scalable and sustainable solutions, and really future-oriented. No? So, and let me give an example. So when you look at the future trends of health in the region, we all know that, as Jana mentioned, okay, there is anyway an adaptation needed because the current system cannot cope. And one of the important things is people are getting older. So there are other needs. There will be more non-communicable diseases. Now, if you look at the health expenditure of a typical country, you will find about 80% of the budget goes into infrastructure and salaries. And only about 20% goes into the diagnosis, equipment, and medicine. Now, if you look at pictures of hospitals 100 years ago and today, you will see that the infrastructure actually is not that much different. By the way, we treat with quarantine something that was invented by the Venetians hundreds of years ago that we use now in COVID. No? Now, the innovation happens in the 20% where diagnosis has changed dramatically, technology in surgery is advancing, and there are many treatments invented that save actually millions of lives. Now, however, I think too many people don't get the benefit of the innovation. And that means that we have to change this 80-20 relation and improve the efficiency of our systems, and with that create space for the innovation so that we prevent better, that we diagnose better, and we treat better. And I think with this, we will have much better outcomes with the same resources, not saying that in Latin America, we spend enough on health. Now, as Movement Health, I think we believe that the way forward is the collaborative, as I said in the beginning. And so collaboration actually means that we can better transform health systems and push innovation. As I said, I'm an advisory board member, and I'm very inspired of what we can actually do. And I just would like to give some examples. So in Peru, for example, we have a pilot ongoing where we actually work with the Ministry of Health and the government of Cusco. And the goal there is to improve the management and the execution of the public health budget through digital infrastructure solutions. And what we do, we actually leverage an integrated and real-time data management system that can help make informed decisions as how and where to invest resources. Now, you can ask yourself, why would you actually do that? Well, the background is that the budget execution is often 80% or even less. So if we can improve the system, so they can use the existing resources much better and treat more patients with what they already have. Now, another example in Chile is something that we call an innovation challenge, where we bring together in the ecosystem, the startups and entrepreneurs with policymakers and other stakeholders. And the goal here is we have seen there is a huge delays in the public sector hospitals. And when we can reduce these delays, we actually treat patients much better and save a lot of money because, as I mentioned before, in the COVID situation, an earlier, better diagnosed patient probably costs the system much less because you treat them much earlier when you have a chance to cure. So the goal is to use these pilots we have at the moment and ensure that we scale these solutions in the region and the world and can really learn from each other. So in a conclusion, I think we agree that all stakeholders involved need to learn from COVID and the experience and looking at what happened to the health systems, and then work collaboratively to make sure that the health funding actually is not seen as a cost, but it's a long-term investment. And I think their public-private partnerships is the way to do that. So thanks a lot.
Thank you, Ralph. That was great. Really appreciate it. Let's finally turn to Miguel for some remarks. Miguel.
Thank you very much, Michael. It is a pleasure to join you in this afternoon. And thank you, Eric, also for inviting me. And I thank also the panel members. So health has become the centerpiece of policy discussions. When one asks, economists, what's your best, your most effective tool to regain growth and to recover from a severe recession, it is really getting the vaccine, getting the healthcare provision timely. So health, as ever before, has become prominent in the discussion in most Latin American countries, and I think over the world. And let me tell you a little bit about Peru, and one of a middle-income country that had a good reputation of having good economic management. But I think the pandemic really put the reality, the very, very fragile reality front and center. So to the question of this panel in terms of being effective and efficient in terms of investments in health, the answer is really they haven't been at all in countries such as mine, as Peru, which is, I think, unfortunately, one of the hardest hit countries perhaps in the world with a decline in GDP growth below 11%, and having sort of the death per capita among the highest in the world. So there's something that we haven't done right, and we're still in the midst of a pandemic. As I was discussing with my colleagues at the panel, we only have 2% of the population having one shot vaccinated. And I was asking about California, and they're really, going to a different, they're at a different level. So we're really, this is something that is really important to be able to talk about the post-pandemic. We're still in the midst of lockdowns with very severe and harsh social and economic costs. So what has actually failed in a country such as mine? And I can think that this is something that can be extrapolated to other realities in other countries. Well, basically, when we got hit hard by this pandemic, we didn't have the capabilities, the ICU units, the ventilators, to really be able to respond to such a severe shock. So we went into very severe lockdowns. At a point in time, a year ago, for almost 3 to 4 months, 60% of the economy was in lockdown. And this really is huge, for a country that was still in a rather mediocre growth scenario as other Latin American countries were before the COVID hit. So this, lockdown initially wasn't only to contain the propagation of the disease, but was for governments to actually accelerate the response capability and have more ICU units, more hospital beds, and be able to treat the sick, and this is something that's still ongoing as we're peaking the second wave in our country after more than 13 or 14 months ever since the emergency hit our country. So this, obviously, there's many explanations why. I think one has to do with, as Rolf was mentioning, we are a country that benefited from a boom, a bonanza a decade ago. And although resources were available, they weren't spent wisely. So there's an efficient spending in terms of in the healthcare sector and in other sectors in particular. And this recession has really put a strong strain on our economic capacity, our fiscal capacity. So now you're seeing, a very, very strong protest in many countries. Lately in Colombia, that you've seen really citizens being asked to increase the tax pay, the tax burden, and they are really against this. And the same thing happened, in terms of the rejection of the quality of the services provided in education and health in Chile a couple of years ago. So this has propagated. Even now, we're in the midst of an election in our country, in Peru, in which 3 decades of market-friendly policies are being questioned because really they haven't really benefited most. And I think the health crisis is a clear example of those problems that we're facing. So I think as we talk about investments that are wise, that focus on prevention, which has actually, it is something that I endorse completely, as Jana was mentioning here. In Peru, what we've done is there's been a focus on building hospitals, but hospitals without the capability of catering to patients, without the appropriate maintenance, without the doctors, without the inputs, without the meds available. So there's been really a push in terms of concrete and cement investments, but not focusing really on the service delivery, which is really key to be able to have a more healthy population, healthier labor force, which actually is a burden on our growth and our development looking forward. So there has to be a shift from hospital building to appropriate service delivery, and also a shift from being really reactive to being more proactive in terms of prevention. Because we are not only hit by the crisis of the COVID, but we have actually seen a accumulation of diseases, cancer, diabetes, other diseases that haven't been treated. And so the morbidity has actually increased during this past a year. So that's something that one needs to ask why. And actually, unfortunately, the question is that it seems that building a hospital, it's more prone to be subject to illicit and corrupt sometimes behavior. And this is something that also has hardly hit Latin American countries and my country itself. So there's a question in terms of the role of where to focus, where to put the priority in your health investments. Focusing, going away, trying to strengthen the primary care and the preventive care, and focusing less on hospital building and more in terms of service delivery. So I think one key thing is in terms of innovation, in terms of having, we're focusing, for instance, in the primary level, you need to have the capability of working in networks, and the capability, for instance, to having the minimal to have is something that we are really a laggard in Peru, and I guess it's the same thing in other countries, is having your electronic medical records. For that means that you have to have the digital capacity, and you have to have the internet, you have to have sort of the interoperability platforms to be able to, for the patients that go into this initial level, to be able to be referred to other levels, of more complexity need be. So there is a question in terms of thinking about innovation, in terms of the role of the private sector, which there is a backlash against in many countries in the region. So rethinking smart PPPs, rethinking sort of smart healthcare, those are things that we need to really put our brain power into that. Because really, as the reality of my country, and I'm sure many countries in Latin America is still the slowest growing region, according to IMF recent projections. We need to actually have more investments in health, more effective, more efficient, bring in the private sector, but also thinking in terms of the sustainability of the public, spending or investments in health. And that goes again, thinking about tax reform, which is a very, very difficult reform to tackle. But most certainly, it is absolutely necessary to be able to invest more because investments haven't been, we spend very little in health, 4%, 5% of GDP, which is way below the OECD average. But we need to spend those resources, effectively and thinking about service, quality of service delivered to our citizens. So I'll stop there, Michael, for the discussion. Thank you.
Great. Thank you. Thank you very much, Miguel. That was terrific. And thanks to all of our speakers for some excellent opening remarks. I just want to take this opportunity to remind all of our participants again to submit questions using the Q&A function on Zoom, or you could email questions to meetings@thedialogue.org. And we already have some questions, and I'm sure we'll get some more. But let me just start, if I could, with a few questions to our panelists. And again, I think there was a mix of kind of a sober assessment of where we are, but also pointing to some of the opportunities and some of the directions that I think need to be pursued to focus on effective and efficient investments in health. One of the questions, since this is the Inter-American Dialogue, I wanted to ask our speakers is, Rolf talked about collaborative approaches with public and private partnerships, and cited a few examples, I think, in Peru and Chile. Just wondering how speakers, if there are any kind of broader opportunities for collaboration region-wide, the role perhaps of the United States in being helpful in this agenda. Is there a cooperation beyond the sort of the national level, public and private, that could be useful? Are there regional organizations, and also talk about maybe the multilateral organizations, the IDB and others? How do you assess their current role and how that can be potentially even more useful in promoting some of the ideas that have been laid out? Who would like to start with that? Rolf, you want to start with that?
Yeah, thanks a lot, Michael. And I think I would add there and start probably there where Luis Miguel was heading as well with the digital piece, because I think that's at the end, it's probably you need to find country solutions, because at the end it has a lot to do with legislation. A good example is telemedicine. You want to do telemedicine in the country, well, you have to have the legislation, what is allowed and what is not allowed actually to do on a distance. Mm-hmm. And I think so where collaborations can work is how do you create together a framework which afterwards makes it much more attractive as well for whoever, the telecommunications companies or all the others that want to play in the field of telehealth can enter. And I think that could be something. As I know that from the bit there are some of the agreements that to help countries adapt telehealth. Now the question, how can we help each other to make sure that this actually happens, that we have this digitalization of healthcare happening in the countries? And I think that I see as something that we can work together. And I think because at the end, policy, I still see that many of the actions that will need to be taken, they are local.
Yeah, right. Miguel, do you want to have any thoughts, or Jana?
Yeah, jump into this with two comments. I mean, I couldn't agree more with Rolf that healthcare is a very local industry. It's a very regulated industry, and most of the players are very local. So a lot of the service providers actually are really community-based in many parts of the world and many parts of Latin America. And I think that's one of the challenges and opportunities. It's an opportunity because people know their local environment. I think what the pandemic has done now is two things that make me more optimistic that we might see more collaboration in the future. First one is on the innovation front. We have never seen vaccines or just about any other new treatments be developed as fast as we did last year. And I think we are extremely fortunate to have a large number of vaccines that actually are very effective. I think we could be in a much dire strait today if that wasn't the case. We just need to make sure they get to everyone. The opportunity here is to continue that kind of collaboration between public and private sector and internationally across the board, so that we really do have the knowledge and the research side of things quickly disseminated and putting into practice. So I think that is one area where we really hope there will be continued collaboration and continued improvement in the capacity for us to find solutions faster. So that's one area. The second one is that this pandemic has been a real wake-up call for a lot of companies on the question of health of their workers, whether it was a manufacturing situation where there was infection within their workforce and they had to deal with that, whether it was operations with services with customers where there was a concern about the risk of infection across between customers and with workers and customers, etc. And now I think most recently some of the companies are thinking about what can they do and how much can they do about enforcing vaccinations or helping their workers get vaccinations. This, I think we have heard from a number of companies who are thinking, should they play a bigger role on their employee and workforce? And we hope that conversation will continue and there will be more that they can do in terms of prevention, especially as we see some of the unsolved challenges be particularly influencing the working age population, whether it's the musculoskeletal challenges or mental conditions, for example. So I'm hopeful that we'll see companies play a bigger role, especially as the population ages. Workforce attraction and retention will be a bigger issue, and the companies will be big beneficiaries if people don't retire early, they don't take sick leaves, and they are as productive as they can be in the workplace.
Thank you. Miguel?
Sure. I think, Michael, there is two areas of regional hemispheric cooperation, and there's also more bilateral. So in the bilateral, for instance, what we saw in Peru was, we had a deficit for oxygen, and there was oxygen being delivered from our neighbors, from Chile and from Ecuador at some point. So I think there's space for cooperation. And I think in terms of more collective action, in terms of more regional, I think in terms of access to information and best practices is something that is much needed. Given that there in some countries there seems to be a sort of a confidence or mistrust between public and private entities. The role of multilateral institutions, the role as honest brokers, also can play, an important, effect in terms of triggering more collaboration. So I think that those are areas that could be boosted. For us, COVAX facility has been important, although it wasn't really catered for a middle-income country, it was catered for the poorer countries. But given the problems that we had to face, we had to tap into COVAX facility, which is a multilateral, vaccination, to be able to have access to vaccines that were very difficult to agree upon and to negotiate with the different, different pharmaceutical companies. But I think the U.S. can play a very critical role. I think the announcements made by President Biden recently in terms of having more of a relaxation of IP and being able to actually have more flexibility to access the vaccine. Currently, given the crisis in India and other parts of the other large countries. I think that's something positive. It's not going to be easy. Of course, nothing is easy, and if you have to agree that upon over 150 countries in the WTO. But I think having a U.S. leadership in certain areas is critical. We saw a lack of U.S. leadership during the previous administration for this sort of collaboration. So having a more of a multilateral, attitude is really conducive to a win-win for all countries involved in that. So I think the IDB, the Pan American Health Organization, and obviously working with private institutions is the way to go. I think we can actually, and there's many efforts. Rolf was mentioning some. Roche has been quite active in many countries and in the region, and other pharma companies. So I think there's space for actually working and focusing on health treatment, on best practices, and having a smaller wedge between sort of the industry and the patients and governments. And I think that there is, I don't see another way really to go beyond the local component being really a domestic agenda issue mainly. I think there is space, a lot of space for more regional cooperation in different sorts to actually improve sort of the health provision for our countries. We have been quite actively using PAHO, for instance, to be able to procure meds into the country. That has been quite useful. And I think these sort of initiatives should be pursued more broadly beyond just getting sort of medicines and pharmaceutical products into the region. And there are other areas that we can actually learn from other experiences and try to replicate them as much as we can. So I'm hopeful that will happen. That requires leadership, and we're seeing a different sort of a view coming from Washington, given this is an inter-American dialogue. So I have to say that.
Thank you. I appreciate it. There have been a number of questions that have come in from our participants specifically on the Biden administration's decision, which I think was a surprise for a lot of people who are following this, but just people wanting to know exactly how much can we expect, what difference will this make, and so forth. So I think your comments were very, on the mark. Just speaking of the summit of cooperation, we have a question also specifically on the Summit of the Americas, which the 9th summit will be coming up the end of this year, early next year. And the question is, could this be a useful vehicle to launch a permanent collaboration for public-private partnerships in the area of health? So I'll leave that out there, and if everybody wants to pick up on that, that would be an area. But we do have a summit coming up. Rolf, do you want to mention?
Yeah, I think it's absolutely right. So the Summit of the Americas, actually in collaboration with the IDB, I think there are opportunities there to kickstart things. I think it's a good forum, and I would just say a short answer: yes, that's absolutely a forum that we all should use. Okay,
great. Let me go. We have a number of other questions that have come in, and I just wanted to throw them out and see what the panelists think. When it talks about, I think some of you alluded to this already, but on health infrastructure investments, there have been some approaches. One of the questions is some countries in Latin America have expanded existing capacity. Others are building new emergency infrastructure to deal with COVID cases. Do you believe that post-pandemic investments should focus on expanding existing hospitals or new and smaller health centers? Jana, you want to take that?
Happy to. Two quick responses to that. I think one of them specifically on COVID, I think one of the concerns that some people have raised is that we will see the pandemic as the big fire, and because we ran out of the fire trucks in the emergency rooms, we basically think that we need to be prepared and have more fire trucks, instead of obviously doing the thing is making our houses more fire resistant. So I think there's a very clear parallel to the health system as we look beyond the pandemic, which is the more healthy we have our populations, the less at risk they are, both of the long-term chronic conditions that we have been talking about, but also of future pandemics. It's very clear that people with pre-existing conditions were hardest hit during the COVID and continue to be. So I think that is one big takeaway here. I think this is not a change on what we should have done prior to the pandemic. It is more of even a stronger case for shifting into prevention, because that's going to add to resilience. So how to get that resilience and that long-term health? And I think it's very clear that in Latin America, both because of high levels of inequity in access, there are large areas of low-income neighborhoods as well as rural areas that don't have access to the extremely effective preventive treatments, or whether it's for maternal health or child health, for example. And I think that is definitely one that we won't achieve by investing on the existing hospitals. We need to expand the reach. And I think that's not just the people who don't have access. I think in general, across the globe, even in the developed countries, we tend to be not investing enough on primary health, primary care, and the kind of health care, if you want, rather than the sick care. And I think that extends to even thinking of health more broadly as a community urban development issue. So how can we build neighborhoods and cities and towns where people can grow up, live, and age in a healthy manner? So I think for us, it's very, very clear, moving it closer to people and making it easier for people to live a healthy life and having the information to make the right choices is critical. And over time, we will need less of the hospital care because no one wants to spend time there. I think that is, there's just very little. We obviously want them to be there when we need them, but we would much rather not have the need.
John, if I could just follow up with you on that. I mean, do you see any signs that things are moving in the direction that you're proposing anywhere in Latin America, or are there some bright spots there that are?
Absolutely. It's just, frankly, it is easy for us to say. It is hard to do in practice. It is just very, very hard. A large number of healthcare providers have been trying to do this for a long time. And I think there's a lot of successes in Latin America of the vaccination programs across the board, clear improvements in health across the board. I think there is initiatives of addressing obesity and diabetes in Mexico, for example. There's been attentions on limiting childhood nutrition in Bolivia, for example, that has really reduced stunting in children. There's a lot of efforts that are going on. I'm by no means saying that there hasn't been good successes already. There is just the opportunity remains to be, and it remains to be on that side more than the biggest and highest return for quality of life as well as economics comes from the prevention side.
Great. Miguel, you want to add to that?
I couldn't agree more with Jana. And actually, there's an interesting fact here coming from Peru. 45% of the population really go to pharmacies to get their diagnostic and to get sort of their attention. So there's something wrong there. And about a third, we have universal coverage, supposedly, but a third comes from out-of-pocket spending, which is a lot for, large segments of the population. So I think to actually focus on improving this primary attention, preventive care initially, I think many things have to change also at the central, in terms of the health strategy. So three things that I think are needed from the experience and actually it's being discussed now, not as much as we wanted during the current electoral period, is you need to actually spend more on information, having more data to actually know where the needs are, where the demand comes, where the available supply is. I think that's critical information. The other one is really changing sort of your procurement procedure. The procurement in the region is really focused on procedures rather than ensuring the quality of those services. And I think there is opportunity for, again, rethinking sort of the PPPs and private sector participation as we improve state capacity, as we have more conducive changes in public policies focusing on service. I think you can do PPPs. We have good experiences in Lima, for instance, and good experiences told by patient satisfaction surveys that they actually feel that they have a better service than going to a public, health care provider. The issue is, again, political. We're here in a political world where there's a lot of mistrust, and this is something that we really need to confront, because I think the solutions, that we're talking about need to have as a building block more cohesion and less mistrust among actors, to be able to actually focus on long-term investments that cater towards this problem. So I would add those, and obviously the financing is critical. We need to talk about financing in a sustainable way, and that involves different sort of mechanisms: pay for performance, fee for service, other sorts of different initiatives that I think need to be discussed to have sustainable healthcare quality provision.
Great. Ralph, you want to weigh in on this?
Yeah, I think I can only agree with what the colleague said. And the only thing is, I would say, if we think about the longer term trends, whenever you discharge more people from the hospitals by having a better primary care availability, I think that's absolutely crucial. I think if you just look at the machines that you needed in the past that fill the room to diagnose something, that getting sometimes today on an iPad, on a mouse-like device, I think that allows you to adopt technology that actually goes out. And with telehealth, you might even do some things that out in the provinces, that actually in a central room that somebody can take a look at and help them, and things like that. So you can discharge. I think it's not about building a lot of hospitals new. Now, there is one thing that you probably need to do, and this to think about, okay, what are the emerging trends when your population is aging? And you see, there are certain diseases they're coming with age. And you might need to adapt your infrastructure so that you can do that. But the more you discharge to the primary care world the basic diagnosis, and then I think you have much better capacity use. And I think that's an important thing to look at.
Great, thanks. Miguel, I wanted to follow up with one question from a participant who asks about on the question of tax reform, which you've talked about, and the objective of preventing disease to help healthcare systems. Should governments have more taxes on unhealthy food and tobacco than they already have? Is that an area where that should be pursued?
Sure. No, of course. And there's been progress in terms of having excise taxes to actually discourage sort of unhealthy or on alcohol, on tobacco, on. So I think there is for one thing, there's two areas that need further public intervention, and you can do it through taxes. Has been to really discourage, encourage more healthier habits, as was alluded by some of the panel members. That is absolutely critical. But usually when you do this, then we have the other thing that we are informal economies, and then you have smuggling and contraband. If you were to increase taxes way too much, then you encourage sort of illegal, activities. So that's sort of the issue. So you need to improve on compliance, because usually when one increased excise taxes to discourage, alcohol drinking or tobacco, then you have, smugglers coming from Bolivia or from Brazil, and then there was those were policies that didn't, weren't as effective. I think overall, given the recession that we're facing, and given the fact that we haven't been spending enough and in quantity and quality, I think we need to really think, in terms of sustaining this effort in healthcare. So we need to spend more, but it has to be in a sustainable way. And that means you have to increase your tax base. That means you need to comply with the law. There's a lot of tax evasion, tax avoidance in the region. I think also the efforts of the Biden administration, of Secretary Yellen, in terms of having more of a, less loopholes and more, for everyone to pay their fair share, I think that's something that will come into the discussion. It has to be done technically. You cannot do it, as threatening to, pitch, as some sort of a social justice cause. It has to be in terms of doing it in a technical way to disincentivize certain behaviors, and to also be able to gather more tax revenues, because we still have lots of investments to do. So I think the discussion in terms of tax reforms, which won't be easy, just look at Colombia. There's discussions here that are coming up, and in other countries. That is sort of the big next phase of policy priority, I think, that will be discussed in societies, a new social contract, as I say, in terms of having everyone pay their fair share, and to be able to have more resources, but to be spent wisely, effectively, efficiently. Otherwise, there's no point in going through this. It has to be a joint, integral way of focusing. So this financing of healthcare and education and other needs that we still have.
Right. There's one question that I think is really, all of you have addressed it in some form or another, but simply the question of, how do you overcome the challenge that investing in healthcare, the role of politics, basically, that investing in healthcare under the best scenario, in accordance with all of you are suggesting, is a long-term proposition, and it doesn't have benefits in the short term, and so political leaders are not going to want to really make that commitment, because there'll be the next government that will benefit from that. I mean, anybody have any thoughts on how that may be just an inherent problem that's very difficult to overcome, but Jana, do you have any thoughts on that?
Yeah, I think that's a great point. And in our research, for example, we looked at the next 20 years. And the truth is, everything that we know won't have an impact in the next 20 years. But let's take the 20, 30-year-olds. Changing their behavior will make a big difference on how they feel when they are 50 and 60, but not necessarily in the next 20 years. So the time lag there it's a real challenge for political reasons, as well as for some investment and economic reasons, because it's hard to have people who have such a long perspective. So the question is, who are the folks who really do have a long-term perspective? And I think there are a few examples. So for example, life insurance companies who also provide healthcare insurance for lifetime, I think those are organizations that can potentially have an interest of really trying to help their populations to be healthier. Same thing applies for let's say, pension funds who basically have a health component on their pensions. I think California Public Union pension funds being one example. I think there is some of the sovereign wealth funds. So thinking about who are the folks for whom the timeline actually is on decades rather than just months or years is one way of bringing in a new pool of folks into the conversation. But I do think that as someone who comes from the economist side and had now spent a lot of time talking to healthcare providers, it is inspiring that on the healthcare service side, a lot of people really truly have the long-term welfare of their patients as the priority. And I'm hoping we can somehow shift the debate on health from just purely financial costs today into the broader benefits in the long term. And I think, Rolf, you have mentioned a number of times the aging challenge. It is clearly an increasingly big financial challenge for governments. Mm-hmm. Keeping your population healthy is a way to not just slow down, but potentially in some cases even reverse the decline in working age population, because you have people who are healthier, they don't retire early, and they might choose to work longer. We are seeing that be a trend when people have the choice, particularly educated folks with the human capital. There really is an economic return that can come increasingly urgent as we see working age populations decline in many nations.
Great, thanks. Let me ask, Rolf, you wanted to weigh in on this?
Yeah, I have a thought here, and I think I absolutely agree. If you look at the very macro level, that all the indicators until they move, they are long-term. Now the question is, and I think, Jana, you mentioned this, when you look at what is the behavioral change and the things that is necessary in order to change it. That's very much on the community level that you need that. And I think if you attack this problem on a community level, I think you get much faster replies because the people, the voters, they actually see it. They see it from the day one you start to move something. And so I'm probably an optimist in this respect, but I think if it's done on the right level, a community level, then you might have an impact, a lasting impact, because the people see it every day.
Great point. I couldn't agree more.
Absolutely. Let me ask one final question, if I could. Biosimilars. Anybody want to comment on can they play a role in achieving healthcare financial recovery?
Well, a true biosimilar is part of the story like generics. That means in an innovation cycle, you have an innovation until your patent is over, then you come to biosimilars, then come to the generics, which means that you should have lower costs at the end, and which you can reinvest this into the new innovation. I think that's the natural cycle of our business and how actually room is created for innovation. So yes, absolutely. Terrific.
Great. Thank you. We've reached the end of our time. I don't want to abuse our wonderful, wonderful speakers and want to thank Rolf and Jana and Miguel for sharing their perspectives and insights, expertise with us. I think it's been a great discussion. Very, very interesting. I think we've pointed the way forward. If we could just bring others around and mobilize support, I think we can make real progress. But I think this was an excellent session. I want to thank all of you, and I want to thank all of our participants for joining us, for listening, and also for posing very, very interesting, challenging questions. Thanks again to my colleague Eric Brand and Kate Lancet for their help in organizing this. And the dialogue will continue to have meetings on this subject because it's not going to go away. There's a lot more to discuss, and we'll be following developments closely as countries in the region try to grapple with this enormous challenge moving forward. So thanks to everybody, and we'll continue to be calling on you and hope to engage you in future events.